Now, in thinking about how do we move from where we are to a system where we're delivering higher quality care, safer care, and doing it more efficiently, changing patient behavior is an obvious starting point. This slide is borrowed from the Commonwealth Fund, and it shows that, you know, on some simple things, prevention, we're doing a terrible job, and it it matters, but nobody's doing it well. It doesn't matter if you're wealthy, it doesn't matter if you're insured all year, you're still getting barely half the time you're getting the recommended screenings and preventive care. Obviously, those numbers get worse for people who are uninsured and who are poor, but the fact is, nationally, we're doing it 49% of the time. This is, you know, just screaming out for attention. If we could raise that 49%, how much could we save in terms of dollars? How much could we save in terms of lives, in terms of, you know, hardships and heartache? So the question is, how do you move that 49% up? How do you get more people to get that preventive care that we know is effective, we know is cost effective, but for some reason doesn't happen? PHRs are a way to use technology to start focusing on individuals and that patient behavior that is that low-hanging fruit in a variety of ways. And, you know, it's about getting communications between physicians or public health entities or whomever and individuals so that they're better informed about their own care. They're better able to be stewards of their own health. It's also obviously a way to deliver information at the point of care, which is critical because, you know, so often, particularly in emergency room settings and the like, that doctors are flying blind. And if the doctors and nurses don't know who's in front of them and what their history is or what meds they might be on or any of their lab values or any of that, then of course they're going to start out ordering up the battery of tests, and it's going to take time, it's going to take money. So PHRs have that capacity to start really to much better engage consumers and to much better inform providers, but only, of course, if people actually use them. And what we know is that despite a lot of efforts by a lot of people and a lot of money sunk into those efforts, PHRs are not widely used at this point. And until we can figure out how to get those take-up rates higher, the value of PHRs may be obvious, but not able to be tapped.